let's transition into talking about breast massage. This is something that is actually legal, at least where I'm at. But I think that people, much like breastfeeding, there's a sexual component when it comes to the breast, and thus people don't really talk about it. But what's your opinion on breast massage? Do you have any experience? Can you talk a little bit about that?
Yeah, absolutely. Had I known, I would have gotten my little model boob to show you. But besides breasts, we've got millions of little glands, and they look like little grape clusters. And so I always recommend that moms breast massage prior to nursing, and sometimes after. It just helps get things moving, get things flowing. It really prevents clogged ducts, because even when the baby is nursing, sometimes the ducts will stay a little bit full with milk, and if you massage it, it will kind of help get it out and make you feel more comfortable, especially in the early days when moms are experiencing engorgement. This is something that I tell them to do every feeding until their body can regulate and they're not so engorged. And
Can
there's a
you
lot of
can you explain what engorgement is for those that aren't familiar?
Sure. Engorgement is when breasts go from like normal size to all of a sudden you had like a huge boob job overnight. Your breasts get super full, they get hard as a rock sometimes, you feel like lumps in the breast. And what it is in the beginning, when the lactogenesis is what it's called, from when your body is producing colostrum, which every mom has when the baby is born, to when their mature milk comes in, and that can take between anywhere from 3 to 7 days. Your body is like, okay, well, we need milk, but it doesn't understand that you just had 1 or 2 babies. It's like, here's milk for like 3 or 4 babies. And so your breast, what do I do with all of this? So the engorgement is the overly full, abundant milk that you have in those first 3 to 7 days. And then, I try to tell my moms all the time, do not pump. Pumping complicates things. It makes things worse because your breasts work purely on stimulation. So the more you stimulate, the more you're going to produce. And so hand expression is the first thing I tell them. Hot compress or even soaking the breast in hot water with the massage is going to help to soften the breast tissue, get some of that excess milk moving, and allows the breast to be more pliable so that when the baby does nurse, it's soft and they're able to pull some of that excess milk. And the more moms do that and just allow the baby to nurse, it really helps the body understand how to regulate. So instead of making milk every 5 to 10 minutes where you're like feeling full all the time, it understands, oh, I got to make milk every time baby nurses, which is every 1 to 2 or maybe 3 hours.